We begin with another grim milestone as the worldwide death toll has now surpassed 100,000. Here in the U.S., there are nearly 500,000 cases with more than 18,000 deaths. More than a third of those are in New York State alone. That has more cases in that state than any other country in the world.
There is some good news this morning as federal and state officials say it looks like those stay-at-home orders are working, but they're urging everyone to stay vigilant and stay safe, warning that if we don't continue to heed the warnings, the numbers could change. And as President Trump tries to decide when he can start getting people back to work, he says he'll announce early next week the members of what he's calling an Opening Our Country Council. The task force will help advise him on the next best steps to get the economy going once again.
Our team is covering this crisis from all across the country. We want to begin with NBC's Kathy Park at the National Tennis Center in Queens, New York, that's become a makeshift hospital. Kathy, good morning.
Peter, good morning to you. When there was a growing call for help in New York, healthcare workers from across the country responded. Some even traveled as far away as Anchorage, Alaska. Now they're here at the National Tennis Center turned temporary hospital. And as New York continues to fight back this disease, there are some signs of improvement.
This morning, a new mission for the famous tennis courts that host the U.S. Open, now serving as a field hospital treating coronavirus patients.
The total number originally was going to be 350 beds, will now be 470 beds.
In neighboring New Jersey, FEMA dispatching dozens of out-of-state ambulances to MetLife Stadium in East Rutherford to respond to the crisis, which could hit an all-time high this weekend. The worldwide death toll has passed 100,000, and the U.S. broke a global record with more than 2,000 deaths in one day. But the epicenter of the nation's outbreak appears to be turning a corner. New York Governor Andrew Cuomo sharing cautious optimism with infections slowing.
Change in ICU admissions is actually a negative number for the first time since we started this intense journey.
And more encouraging news out west as California sees its first daily decrease in ICU admissions. But to continue slowing the spread of the virus, officials in Beverly Hills now require residents to wear a face covering in public. On the front lines of this fight, the battle is far from over as doctors and nurses document the struggles of saving lives. Dr. Ernest Patty is at St. Barnabas Hospital in the Bronx.
It doesn't seem like it's slowing down. Let's hope we reach that plateau at some point soon, or we flatten the curve. I'm hopeful.
These haunting images show the reality of keeping up with a record-breaking number of deaths. Bodies being buried in New York City's Hart Island. This public cemetery averaged about 24 burials a week. Now it's per day, according to the Department of Correction. But the invisible enemy hasn't won. Even while separated, the show must go on. SNL returns tonight with a new episode produced remotely. And a New Jersey football coach still found a way to go the extra mile, delivering 88 championship rings to each member on the team, just minus the hugs.
And here at the National Tennis Center, they were anticipating the arrival of about 100 patients yesterday, mostly from hard-hit Elmhurst Hospital, which is just a couple of miles away. And moving forward, if they don't need all the beds in this temporary facility, we're told that they will transition to a quarantine center to treat patients with milder symptoms of the virus. Kristen?
Kathy Park, thank you. The question now on everyone's mind this morning, when will life get back to normal? President Trump says he hopes it will be sooner rather than later, but calls it a very difficult decision that needs to be guided by the science. NBC's Kelly O'Donnell is live at the White House. Good morning, Kelly.
Good morning, Kristen. President Trump readily acknowledges the decision to reboot business life and get people out of their homes is the most consequential call he'll have to make. And there is urgency in both directions to keep up mitigation against the virus and to restart the economy.
The president promised to be guided by science.
I will certainly listen. I will certainly listen.
While also relying on instinct.
The metrics right here. That's my metrics.
Bearing the heavy responsibility of when and how to lift social distancing restrictions set to expire April 30th.
I'm going to have to make a decision And I only hope to God that it's the right decision. I would say without question, it's the biggest decision I've ever had to make.
A new CBS News poll on the president's handling of the crisis shows 47% of Americans questioned say the president is doing a good job. But that's down 4 points since last week.
Should Americans have to decide between staying healthy and going back to work?
We're going to do both. We're going to go back to work and we're going to stay healthy.
Experts acknowledge returning to work without widespread testing to track the virus carries risk.
When we're going to be relaxing some of the restrictions, there's no doubt you're going to see cases. I would be so surprised if we did not see cases. The question is how you respond to them.
The president clearly torn.
You open up, could lead to death, and you're right. But you know what? Staying at home leads to death also.
As economic hardships spiral, negotiations continue with Capitol Hill for another massive relief package. While President Trump says Tuesday he will commission a bipartisan group of elected officials, science and business experts to plan next steps.
I call it the Opening Our Country Task Force or Opening Our Country Council.
But in this Easter season, the president urged those determined to hold services to instead heed restrictions and stay home.
We've got to get our country cured. Let's get healed before we do this.
President Trump, who usually celebrates Easter with his family and church services in Palm Beach, Florida, instead will be watching services on a laptop here at the White House. There's no coronavirus task force briefing scheduled, at least not yet, for this weekend. Kristen?
So, Kelly, the president, we all heard him say yesterday that reopening for business will be his toughest decision yet. But I guess the question a lot of folks are asking this morning, is it really his decision?
Well, the president's been careful to defer to the authority of governors who make a lot of these decisions state by state. He does have some emergency powers based on the fact that he has declared a national emergency to try to override governors at certain times if he thinks that's warranted. But we've seen so far he's given the governors the first step. Kristen?
All right, tough decision ahead. Kelly O'Donnell, thank you for that. Peter, back to you.
Kristen, thank you. We want to bring in NBC News medical correspondent Dr. John Torres. Dr. Torres, good morning.
Good morning, Peter.
So, Doctor, we saw that grim death toll yesterday, 2,000 Americans losing their lives. But from public health experts and others, we are hearing optimism now. New York appears to be either at a peak or at a plateau. But for most of the rest of the country right now, where are we in all of this?
And Peter, what you're seeing is the coasts are actually doing a lot better than they thought they'd be doing at this point. That you're hearing about the increase in deaths, but the deaths tend to lag behind the actual cases. So the cases are either staying steady or going down, and that's including New York, California, Washington, those areas that got hit immediately. The concern now is what's going to happen with the rest of the country. We're hearing about hot spots possibly cropping up in other areas, and this is something that experts thought would probably happen, that to start going from areas where there's a lot of travel, a lot of airport travel and travelers go to, and they can spread it, and then it starts spreading to other areas. The lucky part is the other areas of the country, or the good part is the other parts of the country actually started shutting things down very early, so hopefully it doesn't affect them quite as much. And I think overall, the nation, you're seeing optimism and saying it looks like we're actually tackling this, we're getting this under control, and we're starting to see that light at the end of the tunnel, Peter.
Dr. Torres, yesterday the president announced that more than 2 million Americans now have been tested, but it's out of a country of 330 million Americans. He said that the virus will soon be in retreat, but without widespread testing, how would we know?
And that's going to be the difficult part. And like you said, or like he said in the task force briefing, you want to make sure that people go back to work, but they stay healthy at the same time. You want both to happen. And the realism is once people start going out and getting in crowds and getting close to each other, those numbers are going to pop up again. But we want to make sure that we have a good understanding of where those numbers are starting to increase so we can start shutting things down. And that means testing. Two different types of testing. One, do you have the virus right now? We have that test now. It's not as robust as we'd like, but it's getting there. And number two, the antibody test. Who has immunities to it because they already had it and they've recovered from it? On top of that, they're going to have to look at cases in the hospitals, see what's starting to increase in hospitals, and keep a good understanding of that, having hospitals report to the CDC saying, we see more cases, and then start putting in task force, essentially, the CDC sending in essentially the equivalent of coronavirus SWAT teams to go ahead and keep it under control every time these hot spots crop up and keep it down.
So, Dr. Torres, can we drill down on that antibody test right now? That would be a significant piece of progress in this effort across the country right now. As you noted, it would tell people if they already had the virus. Some wouldn't realize the case because they never showed symptoms. Is that a game changer? Would that allow us to accelerate the process of getting back to work?
It is a game changer. The ultimate game changer is going to be that vaccine. We're talking 12 to 18 months before we get that. So in the interim, the big one is going to be getting that antibody test so we know who's been infected. Part of the issue is going to be that once you get it, how are you going to identify people that actually have antibodies built up to it? And we don't know that much about this virus yet because it's new. And so just because you have immunity, do you have enough immunity? These are questions experts are going to have to try and figure out over the next few weeks. Those tests are going to become available. The issue is, are those tests going to become readily available? It looks like it's a faster test, 5 to 15 minutes, so it's not going to be necessarily the cumbersome process that the other test was when it first came out, but it's going to be something that's going to take a little bit of time to deploy.
Dr. Torres, stay safe and healthy, my friend. Thank you very much. Kristen?
All right, Peter, thank you. While people all across the country are being urged to stay home this holiday weekend, Florida's governor is coming under fire because he says he won't close down places of worship, allowing parishioners to gather and pray in person. And that is raising serious concerns about the possible spread of COVID-19. We want to turn now to NBC's Sam Brock in Miami. Sam, good morning to you.
Kristen, good morning. For more than 1 million Catholic parishioners here in South Florida, going in person isn't an option. That's because the Archbishop of Miami is only allowing cathedrals like these to stream online. But the governor has given the green light for the people across the state to come together responsibly, stoking fears of more transmission.
Across the country this morning, empty pews and online services, Christianity's holiest weekend in the coronavirus era.
Most of the pastors agree that they are better off doing what they're doing, which is distancing.
A presidential plea taking root in many big cities like Los Angeles.
We are in solidarity in the spirit, but during these days, we feel the physical distance.
Where Easter services are moving online. At the Vatican, Pope Francis will preside not over masses in St. Peter's Square, but a live stream on Easter Sunday. Yet in some states, a different tune.
The state of Florida is not going to, through government coercion, close a church, synagogue, or place of worship. But we have advocated that folks worship in a way that's consistent with social distancing guidelines.
A pass to pray in person. Not sitting well with Miami's Archbishop, whose 109 parishes are all offering services online.
I'm the Archbishop of Miami. The governor is the governor of Florida. So I'll take care of the spiritual side of things, and he'll take care of the state side.
The Center Arena in Orlando held in-person services on Palm Sunday and plans to do so again on Easter. In hard-hit areas like Louisiana and Philadelphia, defiance on full display. A Baton Rouge pastor who's already been arrested once for gathering more than 50 people says he'll open his door also.
We should not be fearful.
And a Philadelphia spiritual leader promising face masks will be provided to all who walk through the church doors on Sunday. But in New Orleans, boundaries not being tested, but rather spirits lifted.
The Archbishop has been diagnosed with COVID-19.
Archbishop Gregory Amond, still recovering from coronavirus, flying over his parishioners in a World War II-era plane meant to soothe those who couldn't see him in person.
And even in some states where there is not an explicit ban on in-person services, the governors there want to make it clear they don't want people going to religious gatherings in person. Georgia is a very good example of that. Governor Brian Kemp pleading with people to stay inside as the state has prohibited any gatherings of 10 or more people. Peter, back to you.
Sam Brock reporting for us this morning in Miami. Sam, thank you very much. How about some good news this morning? Being cooped up inside is hard on everybody, but it's particularly hard on those with disabilities. So check out what happened when firefighters in West Palm Beach paid a very special visit to a very special person. That is Corey Soderman being greeted by a firefighter on a cherry picker on the balcony of his family's apartment. Corey has cerebral palsy, and now that he's under a stay-at-home order, friends had become worried that he could use some cheering up. Lieutenant Brett Koenig, you can see him, he's the guy on the cherry picker. He said that they showed up because they just wanted to bring a little sunshine to Corey's day. What a great, good piece of news from those folks there in Florida this morning. Kristen, back to you.
I love that, Peter. That's what this moment is all about, everyone coming together. All right, well, thanks for that. Time now for some other news this morning. Disgraced media mogul and convicted sex offender Harvey Weinstein is facing a new criminal charge this morning. California prosecutors announced Friday that they're adding a felony sexual battery by restraint to their case, which already includes multiple counts of forcible rape. The latest charge stems from an alleged sexual assault on a woman at a Beverly Hills hotel 10 years ago. Weinstein, who's currently serving 23 years in prison in New York, faces an additional 29 years behind bars if convicted of all charges in California.
It's been nearly a year since a fire virtually destroyed France's Notre Dame Cathedral, and now the iconic landmark is finally showing signs of recovery. On Friday, the special televised Good Friday service was held inside the cathedral. Because Paris is still under lockdown, only 7 people were in attendance for the ceremony that included prayer and music and a presentation of the crown of thorns of Christ, a relic that remarkably survived the fire.
Meantime, the race for president is looking much different in these new times. Earlier this week, Bernie Sanders suspended his campaign, making former Vice President Joe Biden the Democrats' apparent presidential nominee. But with America under lockdown, the big victory rallies and fundraisers have been replaced by a simple online announcement. NBC's Geoff Bennett is following that part of our coverage. Geoff, good morning to you.
Kristen, good morning to you. You're right. Bernie Sanders' exit from the race now clears Joe Biden's path toward the Democratic nomination and toward that ultimate showdown with President Trump in November. But first, Biden has to do a few things. He has to pick a running mate. He has to set up ground operations in key battleground states. And he also has to try to unite the Democratic Party after what has been a bruising primary. All of those tasks now complicated by the coronavirus crisis. Former Vice President Joe Biden, now the Democrats' apparent 2020 presidential nominee, marking the moment this week during a virtual town hall.
Joe Biden will be the Democratic nominee, and I could not think of a better leader for our country in this moment.
Compare that simple announcement to the full-blown celebration 4 years ago. Nearly 4,000 cheering supporters on hand as Hillary Clinton laid claim to the Democratic presidential nomination. It's yet another striking example of how the coronavirus pandemic is upending the race for the White House, as Biden faces 3 big burdens. Chief among them, winning over Bernie Sanders supporters.
He's inspired and energized millions of supporters, especially young voters, to join him in championing a progressive vision for our country. And he didn't just run a political campaign, he created a movement.
Biden now courting the party's more progressive wing by adopting some of his former competitors' policies. The former VP also needs to quickly close the cash gap as he readies for battle against President Trump's money machine. The latest filings show President Trump with a combined $225 million in the bank, compared to a combined $20 million in campaign cash for Biden. Team Biden now reimagining ways to raise money during a pandemic and economic slowdown. Biden also has to build a top-notch campaign organization in key battleground states to get out the vote. A tough task, with Americans in at least 42 states right now being urged to stay home. Meantime, I'm told the Biden campaign is set to start the vetting process for his vice presidential pick. NBC News has also learned that former President Barack Obama has advised Biden in this process and has told him to pick someone who can help balance his traits. Now, Biden has already committed to picking a woman as his running mate, and he's told donors that he might make that announcement earlier in the process than normal, perhaps even before the party's convention, which has been pushed to August. Peter?
A campaign season like we've never seen before. Geoff Bennett. Geoff, thanks very much.